So this gentleman came to me in the month of January this year with a pain after an injury to the knee joint. So I examined it. It was a stable knee. He just got some x-rays done. But even though an x-ray was enough, he insisted that he got an MRI, and he got an MRI which showed a partial tear of the ACL ligament. So what I did is I went with a conservative treatment. That is, I gave him an initial anti-inflammatory, and after that a good rehab protocol to make sure that he went back to his normal. So 3 months down the lane, now it's April. That is when he had a small little twist while he was getting down the stairs in his office. Now when he came to me, there was a gross swelling, and the knee joint was grossly unstable. So we went ahead and got another MRI scan which showed a complete tear. So what's happening here? So a partial tear of an ACL may progress to a complete tear if there is sufficient fibers of the ACL which are torn. So there's not a proper way of coming to know about this, because initially when we do a Lachman's test, if it is clinically negative, then what happens is we usually don't prefer a surgery. But if the test clinically is positive, then confirming with an MRI scan, that is when we go for a surgery. It was unfortunate for this gentleman to tear his ACL again, but then a progress of a partial tear to a complete tear is usually common. So thus, not all partial tears become a complete tear, and not all partial tears require an ACL reconstruction. But it is, however, the feel what the patient gets after that tear, the instability, the uncomfortness, and also the progress of that and the limitation that particular knee provides is what helps us decide whether to operate or no.